Gary Morsch is an emergency physician. He's also founder and president of COVID Care Force. Joins us now live. Gary, are you surprised 1 year into the pandemic to hear medical workers in the Philippines and elsewhere still dealing with these sorts of conditions? And why is that the case? Is this bad leadership at the sovereign level, or is this a failure in international cooperation or commitment or something else?
Well, I was in the Philippines just a year ago, February 2020, when the first case came in. They felt like the public would follow the mitigation measures and wear masks and social distance, and they did a good job. I think what we're seeing all over the world, though, is kind of a fatigue. People are just tired. They're weary of this year, of this terrible year we've experienced, and so you've got strains now just popping out everywhere, and it's a very, very sad situation as you look around the world.
Yeah, I mean, there's fatigue here in the U.S. from COVID as well, and people are starting to say that they're seeing a light at the end of the tunnel, so behavior patterns are changing. How do you balance that optimism with what is a pretty dismal outlook in the developing world in places like India?
Well, you know, my country, the United States, actually did a terrible job early on. We didn't follow the public health measures. We didn't want to wear masks. It was very difficult, and there's been a lot of people questioning science, but I have to say that, you know, we did a good job in getting the vaccines ramped up and ordering the vaccines and stocking the vaccines. And so in our country, in the United States, the vaccination level for adults now is reaching 50%, so 40–50%. So that's really good news. But it's sad that in many other countries, they can't get the vaccine. They didn't prepare well in advance. They didn't have either the ability or the means to order the vaccines and get them on tap. So there's a vaccine shortage certainly all over the world.
I want to talk about the vaccination here in the U.S. Your group has been working with indigenous communities. Talk about the challenges and successes, I understand, there.
Right. We've early on, when COVID hit the United States so bad, starting in New York, our Indian reservations began getting hit as well. And so I was called by some of the tribal leaders, particularly among the Navajos. That's our largest reservation in the United States. And they said, our elders are dying, and you know, with the elders dying, we lose our culture and our language and all of that. So could you help us? And so we have had teams of doctors and nurses, volunteers on the ground throughout the Navajo Nation and many other Indian tribes now for the last year. And initially we were treating COVID, and then we were testing. But now for the last several months we've been vaccinating. And I can tell you the great news for the Navajo Nation is 70% of their population has been vaccinated, and they have officially reached herd immunity as of this past week. So that's a good news story here, right here within my own country. And I think we're going to see this in other places around the world. Little by little, communities, nations, cities will get ahead of this, and we'll get the vaccinations done.